There is a conversation most men over 60 never start, and it quietly decides whether you sleep through the night or wake up exhausted. I am Dr. Elena Carter, urologist with 2 decades of clinical work translating evidence into practical routines. And I speak directly to you because small daily choices can change how your prostate feels and how you live. Stay with me, and I will share 5 simple, measurable habits that many patients use to reduce nocturia, improve urinary flow, and sleep deeper within weeks. Imagine your bladder as a water balloon and your urethra as a narrow straw. The prostate is the soft collar around that straw. When that collar tightens or swells, flow slows, and the balloon never feels empty. This is not an inevitable sentence of aging. In many cases, inflammation and circulation issues are modifiable. In the next minutes, we will cover targeted hydration, a short walk after meals, regular intimate activity, anti-inflammatory food choices, and a sleep routine that supports hormonal repair. Before we continue, tell me in the comments where you are watching from. I read those messages. Midway, I'll share real patient examples to show how these steps work in practice. I have worked in hospitals and outpatient clinics affiliated with academic centers and kept up with studies from the Mayo Clinic, Cleveland Clinic, and the Journal of Urology. My approach prioritizes prevention and autonomy. You do not need to jump to surgery or strong medications before trying targeted lifestyle adjustments. What follows is based on published evidence and on results I have seen with patients like Mark, Daniel, and Henry. You will get a clear, step-by-step protocol you can begin tonight. Now that you know why I talk about this, let's briefly map the 5 habits so you understand the logic. Hydration timing, movement after meals to improve pelvic circulation and glucose balance, supported sexual activity to reduce stagnation, a diet rich in lycopene and zinc and low in pro-inflammatory foods, and a sleep strategy to amplify hormonal repair and reduce nighttime urgency. When you picture the prostate causing trouble, think of that collar around the straw tightening. Clinically, we call the common, non-cancerous enlargement BPH, benign prostatic hyperplasia, and it affects a large proportion of men as they age. The Journal of Urology reports that by age 60, a significant percentage of men have symptoms that affect quality of life. The prostate sits beneath the bladder and around the urethra. Inflammation, hormonal changes, and reduced pelvic circulation can make the collar thicker or stiffer, increasing resistance to flow. Visualize a garden hose with a cuffed clamp. Any swelling inside the clamp reduces output. Simple measures that reduce local inflammation and improve blood flow often translate into better urinary flow and less nocturia. Statistics from Harvard School of Public Health and observational studies suggest that lifestyle patterns account for a meaningful share of symptom variability. Understanding this anatomy lets you see why timing fluids, moving after meals, and improving sleep matter. Habit 1. Strategic hydration. The common mistake is either drinking too little during the day and then too much at night, or sipping continuously in the final hours before bed. Your goal is to hydrate consistently through daylight and reduce intake 2 hours before sleep. Mechanism. Steady daytime hydration supports urine concentration, reduces nocturnal diuresis, and eases renal workload. Avoiding late fluids reduces bladder filling when sleep cycles are lighter. Protocol. Morning. 500 to 700 milliliters of water within 2 hours of waking. Midday. Regular sips totaling 1.2 to 1.5 liters by late afternoon. Evening. Taper and avoid more than 200 milliliters after dinner. Test. Place a glass by your bed and note if you need it during the first 6 weeks. A 2018 observational analysis referenced by the Cleveland Clinic found a consistent link between evening fluid timing and nocturia frequency. Case. Mark, 64, restructured his intake and dropped from waking 4 times to waking once or twice within 3 weeks. Scene. Dr. Carter. How many times do you wake at night? Mark. 4, some nights 5. Dr. Carter. Try the daytime hydration plan for 2 weeks and keep a log. I can do that. Dr. Carter. We'll review his log at follow-up. Mark smells faintly of peppermint from the mouthwash he uses. His hands tremble slightly when he describes the wakefulness, and his voice tightens as he remembers missing family events due to fatigue. The room has the antiseptic tang of clinic disinfectant and the distant hum of a fluorescent light, but his relief is visible when he imagines sleeping through a whole night. Before we go on, pause and check your last 48 hours. How many times did you wake to urinate? Type a number like 1, 2, or 4 in the comments, or write many nights or sleeps well. Your answers help others know they are not alone and help tailor future content. Thank you. Now let us look at habit 2, movement after meals, which is often underestimated. A 10-minute walk after a meal does more than burn calories. It improves pelvic circulation, aids digestion, and stabilizes glucose spikes that can increase urine production at night. Mechanism: light ambulation stimulates venous return from the pelvis and reduces postprandial hyperglycemia, which in turn reduces osmotic diuresis. A randomized pilot and multiple observational reports cited by Harvard show modest but real improvements in urinary urgency when men adopt regular post-meal movement. Recommendation: after lunch and dinner, walk 8 to 15 minutes at a comfortable pace. If weather or mobility limits you, perform seated pelvic swings and gentle hip rotations. Anecdote: Daniel, 67, began a ritual of walking with his wife Susan after dinner. His nocturia decreased by 1 episode within 2 weeks, and his mornings felt less foggy. Scene with sensory detail and dialogue. Daniel: I used to sit right after eating and feel bloated. Susan: I noticed you picked at the TV snacks. Daniel: the walk clears my head. Dr. Carter: that movement is like turning on a small pump for your pelvic circulation. They feel the cool evening air on their faces, hear leaves underfoot, taste the residual spice of dinner, and enjoy the soft weight of the jacket across the shoulders. This routine becomes both physical and relational, reinforcing adherence. Habit 3 addresses intimate activity and prostate function, a topic with social stigma but strong physiological rationale. Regular ejaculation appears in observational studies to be associated with lower prostate inflammation markers and may reduce risk factors linked to prostate disease. Mechanism: ejaculation and pelvic floor movement support clearance of prostatic secretions and reduce local stagnation. Sexual activity also modulates mood and sleep. Practical advice: aim for frequency that fits your relationship and health, communicate openly with partners, and consider pelvic floor exercises to support control. Case: Henry, 72, and his partner Maria reintroduced intimacy after months of scheduling challenges and reported both better nighttime sleep and improved morning flow. Scene dialogue, 3 to 5 exchanges. Henry: I was embarrassed to bring this up. Maria: we can try small steps. Dr. Carter: start with gentle reconnection and add pelvic floor exercises. Henry: it helped me feel more in control. Maria: and closer to you. The scene carries the faint scent of cologne, the soft texture of the couch fabric, the rustle of sheets, the low murmur of their voices, and a shared laugh that loosens tension. It is important to emphasize consent, desire, and mutual comfort. Habit 4, diet and nutrients, focuses on foods that calm inflammation and support prostate health. Key nutrients include lycopene, found in cooked tomatoes, zinc from shellfish and legumes, healthy omega-3 fats, and antioxidants from colorful vegetables. Foods to limit: processed meats, excessive dairy, and refined sugars, which can promote systemic inflammation. Example plate: a dinner of baked salmon with roasted tomatoes and spinach, a side of quinoa, and a small fresh fruit salad. Studies and meta-analyses cited in major journals suggest dietary patterns rich in vegetables, healthy fats, and modest protein correlate with fewer lower urinary tract symptoms. Patient example: Lewis, 66, swapped 2 fast food meals a week for home-cooked lunches with tomatoes, beans, and greens. Over 3 months, his nocturia frequency reduced and his PSA remained stable. Secondary characters such as Nurse Priya, physical therapist Marco, dietitian Anita, pharmacist Robert, and social worker Evelyn each support behavior change by reinforcing steps, adjusting medications, and addressing barriers. Sensory details include the bright red of cooked tomatoes, the flaky texture of fish, the earthy aroma of roasted garlic, and the satisfying crunch of raw vegetables. Habit 5 is sleep restorative practices that support hormonal repair and reduce nighttime urgency. Sleep is when growth hormone and other restorative processes lower inflammation and regulate metabolism. Poor sleep fragments increase stress hormones and can worsen urinary symptoms. Routine. Establish fixed bed and wake times, dim lights an hour before bed, remove screens, keep bedroom cool and quiet, and avoid caffeine after early afternoon. Avoid large volumes within 2 hours of bedtime and schedule a final small void before lights out. Evidence from sleep medicine research and recommendations from sleep researchers at major institutions support these measures. Case: Robert, 69, adopted a strict sleep routine, began using a white noise machine, and reduced nighttime awakenings. His sense of daytime alertness improved, and he reported less urgency. The scene includes the soft thud of a pillow, the coarse weave of pajamas under fingertips, the cool breath of nighttime air, the muted tick of a bedside clock, and the faint recycled scent of laundry detergent, all building a sensory framework that reinforces habit adoption. Now 2 moments of tension. The first, a sharp PSA rise on a routine blood test triggers fear. I received a call late Friday from Miguel, age 65, voice tight with anxiety. He had always been careful with diet and activity, yet his PSA jumped unexpectedly. The 500-plus character moment unfolds with clinical pacing. I asked him to breathe and described next steps calmly, arranged an expedited transrectal ultrasound and a consultation with an oncologic colleague. Miguel felt the metallic tang of fear, his hands cold against the phone, the world blurred for a moment. We spoke through what the numbers meant and how many benign conditions can raise PSA temporarily, including prostatitis, recent ejaculation, or urinary retention. By clarifying immediate actions and avoiding alarmist language, we converted panic into a plan. The second tension moment centers on acute urinary retention. Late one night, Henry called from home unable to urinate, the pain sharp, the living room lamp glaring. We advised urgent evaluation. The ER drained his bladder and he needed a short catheter. That crisis lasted several hours and left a heavy emotional imprint. The tactile memory of his shaking hands, the staccato beep of monitors, and the antiseptic smell of the emergency unit stayed with him. These moments underscore why timely medical evaluation is essential and why lifestyle strategies are adjuncts, not replacements for urgent care. A concise recap of the 5 habits. Hydrate earlier in the day, walk 8 to 15 minutes after meals, maintain regular intimate activity and pelvic movement, choose anti-inflammatory foods rich in lycopene and zinc, and protect sleep with a strict nightly routine. If one habit resonates, start there and add another each week. If you try the hydration schedule tonight, note your awakenings and bring that log to a follow-up with your clinician. Epilogo at 1, 3, and 6 months, describing consolidated results and lived experience. 1 month, many patients report small but noticeable shifts. Mark slept longer blocks, Daniel felt less urgency walking to the car, and Maria noticed Henry waking less foggy. The initial changes are sensory and practical: fewer interruptions to deep sleep, lighter mornings, better mood, and lower daytime fatigue. You can measure progress by counting nightly awakenings, tracking morning flow strength, and noting energy. 3 months, habits begin to wire into daily routines. The walk after dinner becomes a ritual, the daytime hydration pattern automatic, and the kitchen shifts to include cooked tomatoes and fish more often. Clinical measures such as symptom scores often move in a positive direction. Some men see reductions in nocturia by as much as 30 to 40% in observational settings. Relationships benefit as intimacy and shared routines restore connection. 6 months, sustained change shows more robust outcomes. Circulation improvements, reduced chronic inflammation, and better sleep architecture contribute to lasting symptom relief for many men. In follow-up visits, some men reduce reliance on symptom medications with clinician guidance, others combine lifestyle with medical therapies when needed. Across these months, you will notice cumulative benefits: stronger daytime energy, fewer interruptions at night, clearer mornings, and a sense of control over your daily life. Documenting progress with simple measures like a sleep and urination log, a 1-minute sit-to-stand test after meals, or photos of meals can help maintain motivation. Remember that individual responses vary. The goal is measurable improvement in your comfort and function. If one of these habits caught your attention, pick one to start this week and comment which one you chose and where you are watching from. Share this with a friend who wakes at night. If you want more evidence and step-by-step guides, subscribe for deeper dives into each habit and practical worksheets. This video is informational and does not replace personalized medical advice. If you experience pain, blood in urine, sudden urinary retention, or rapid symptom change, seek immediate care. Small, consistent routines build protection. Hydrate with purpose, move after meals, keep intimate life active, favor anti-inflammatory foods, and guard your sleep. These 5 habits work together to reduce inflammation, improve pelvic circulation, and restore nights of uninterrupted sleep. Try one habit today. Small routines, greater freedom.